Chapter 7 Summary Outline. Introduction. Individual bones are the organs of the skeletal system. A bone contains very active tissues. Bone structure. Bone structure reflects its function. Parts of a long bone. Epiphysis at each end are covered with articular cartilage and articulates with other bones. The shaft of a bone is called the diaphysis. Except for the articular cartilage, a bone is covered by a periosteum. Compact bone has continuous matrix with no gaps. Spongy bones has irregular interconnecting spaces between bony plates that reduce the weight of the bone. Both compact and spongy bone are strong and resist bending. The diaphysis contains a medullary cavity filled with marrow. Microscopic structure. Compact bone, osteons cemented together. Central canals contain blood vessels that nourish the cells of osteons. Diffusion from the surface of a thin, bony plate nourishes the cells of spongy bone. Bone development and growth. Intramembranous bones. Intramembranous bones develop from layers of connective tissues. Osteoblasts within the membranous layers form bone tissue. Mature bone cells are called osteocytes. Achondral bones. Endochondral bones develop as hyaline cartilage that is later replaced by bone tissue. The primary ossification center appears in the diaphysis, whereas secondary ossification centers appear in the epiphysis. An epiphyseal plate remains between the primary and secondary ossification centers. The epiphyseal plate are responsible for lengthening. Long bones continue to lengthen until the epiphyseal plate are ossified. Growth and thickness is due to intramembranous ossification. Growth and thickness is due to the intramembranous ossification beneath the periosteum. Homeostasis of bone tissue. Osteoclasts and osteoblasts continually remodel bone. The total mass of bone remains nearly constant. Bone function. Support and protection. Bones shape and form body structures. Bones support and protect softer underlying tissues. Body movement. Bones and muscles function together as levers. A lever consists of a rod, a pivot, a resistance, and a force that supplies energy. Blood cell formation. At different ages, hemopiosis occurs in the yolk sac, liver, and spleen of red bone marrow. Red marrow houses developing red blood cells, white blood cells, and blood platelets. Yellow marrow stores fat. Storage of inorganic salts. The intercellular matrix of bone tissue contains large quantities of calcium phosphate. When blood calcium is low, osteocytes break down blood, releasing calcium salts. When blood calcium is high, osteoblasts form blood tissue and store calcium salts. Bones store small amounts of magnesium, sodium, potassium, and carbonate ions. Skeletal organization. The skeleton can be divided into axial and appendicular portions. The axial skeleton consists of skull, hyoid bone, vertebral column, and thoracic cage. The appendicular skeleton consists of pectoral girdle, upper limbs, pelvic girdle, and lower limbs. Skull. The skull consists of 22 bones, 8 cranial bones, 14 facial bones. Cranium. The cranium encloses and protects the brain. Some cranial bones contain air-filled sinuses. Cranial bones include the frontal bone, parietal bones, occipital bone, temporal bones, sphenoid bone, and ethmoid bone. Facial skeleton. Facial bones from the basic plate of the face and provide attachments for muscles. Facial bones include the maxillae, palatine bone, zygomatic bones, lacrimal bones, nasal bones, vomer bones, inferior nasal concha, and mandible. Infinital skull. Fontanelles connect incompletely developed bones. The proportions of the infant skull are different from those of an adult skull. Vertebral column. A typical vertebra A typical vertebrae consists of body of bony vertebral arch, which surrounds the spinal cord. Notches on the upper and lower surfaces provide intervertebral foramina through which spinal nerves pass. Cervical vertebrae. Transverse process bear transverse foramina. The atlas supports and balances the head. The dens of the axis provide a pivot for the atlas where the head is turned from side to side. Thoracic vertebrae. Thoracic vertebrae are larger than cervical vertebrae. Facets of the sides articulate with the ribs. Lumbar vertebrae. The support bodies are large and strong. They support more body weight than other vertebrae. Sacrum. A sacrum is triangular structure formed of 5 fused vertebrae. The vertebral foramina is the sacral canal. Coccyx. The coccyx, composed of 4 fused vertebrae, forms the lowest part of the vertebral column. It acts as a shock absorber when a person sits. Thoracic cage. Ribs. 12 pairs of ribs attached to the 12 thoracic vertebrae. Costal cartilages of the true ribs join the sternum directly. Those of the false ribs join it indirectly or not at all. A typical rib has a shaft, a head, tubercles that articulate with the vertebrae. Sternum. The sternum consists of mandibrum, body, and xiphoid process. It articulates with the clavicles. Pectoral girdle. The pectoral girdle, clavicles. Clavicles are rod-like bones located between the mandibrum and the scapula. They hold the shoulders in place and provide attachments for muscles. Scapulae. Scapulae are broad triangular bones. They articulate with the humerus of each upper limb and provide attachments for the muscles. Upper limb, humerus. The humerus extends from the scapula to the elbow. It articulates with the radius ulna at the elbow. Radius. The radius is located on the thumb side of the foramen between the elbow and wrist. It articulates with the humerus, ulna, and wrist. Ulna. The ulna is longer than the radius and overlaps the humerus pituitary. It articulates with the radius laterally and with a disc of fibrocartilage inferiorly. Wrist and hand. The wrist is composed of 8 carpal bones that form a carpus. The hand includes 5 metacarpal bones and 14 phalanges. Pelvic girdle. The sacrum, coccyx, and pelvic girdle form the bowl-shaped pelvis. Each coxa consists of an ilium, ischium, and pubis, which are fused in the region of acetabulum. The ilium. The ilium is the largest portion of the coxa. It joins the sacrum at the sacroiliac joint. The ischium. The ischium is the lowest portion of the coxa. It supports body weight when sitting. The pubis. The pubis is the anterior portion of the coxa. The pubic bones are fused anteriorly by the sphincter pubis. Lower limb. Femur. The femur extends from the hip to the knee. The patella articulates with the femur's anterior surface. Tibia. The tibia is located on the medial side of the leg. It articulates with the talus of the ankle. Fibula. The fibula is located on the lateral side of the tibia. It articulates with the ankle but does not bear body weight. Ankle and foot. The ankle and foot consists of tarsus, metatarsus, and 5 toes. Included are the talsus that help form the ankle, 6 other tarsals, 5 metatarsals, and 14 phalanges. Joints. Fibrous joints. Joints can be classified according to type of tissue that binds the bones together. Fibrous joints. Bones at fibrous joints are tightly connected by a layer of dense connective tissue. Little or no movement occurs at the fibrous joint. Cartilaginous joints. A layer of the cartilage joins bones to cartilaginous joints. Such joints allow limited movement. Synovial joints. These bones of a synovial joint are covered with hyaline cartilage and held together by a fibrous joint capsule. The joint capsule consists of an outer layer of ligaments and an inner lining of synovial membrane. Bursa are located between the skin and the underlying body prominences. Types of synovial joints include ball and socket, condyling, gliding, hinge, pivot, and saddle. Types of joint movements. Muscles fastened on either side of a joint produce movements of synovial joints. Joint movements include flexion, extension, dorsiflexion, plantar flexion, hyperextension, abduction, adduction, rotation, circumduction, pronation, supination, aberration, inversion, retraction, protraction, elevation, and depression.